Good afternoon, everyone. Thank you for watching our live update for Tuesday, December 29th. A quick reminder that we will not have an update this Thursday, New Year's Eve, but we will be back next Tuesday on January 5th with another live update. I hope everyone had a Merry Christmas, and I trust that you're all looking forward to a much better 2021 and a Happy New Year. We have a lot to share today with several speakers for you. So let me get started quickly with just a couple of quick COVID-19 updates. Last week on Christmas Eve, we learned that one resident in Parsons Health Center had tested positive for COVID-19 on the third floor of Parsons. She does have some symptoms, but is recovering and is in her room in Parsons Health Center. Within a day or so of that, we also learned that a CNA in Parsons had also tested positive from the same floor. At this point, we believe these two newest cases are isolated, and we have gotten negative test results on all of our other residents and staff in Parsons since those two most recent positives. So that's really good news, and we are hopeful that that's an isolated situation. And they may not be related. We're not 100% sure. It could be that the two cases were acquired separately. Currently, we have 7 staff that are out recovering in quarantine off campus. And that number is, we've had about 7. It's a pretty stable number. A couple people have recovered. A couple of new people have tested positive over the course of the last few weeks. So we're holding steady at about 7. We have around 25, I don't know the exact number, around 25 other staff that are currently out due to either experiencing symptoms related to what could be COVID-19 or after having been exposed to someone who tested positive. So that's the situation here on campus. We know that some of you have spent time away from campus with family or close friends over the holidays. This needs to be a reminder that we all must stay diligent, following all the protocols that keep this community healthy and prevent the spread of the coronavirus. That includes wearing our masks, maintaining our distance of at least 6 feet, and using hand sanitizer and washing our hands frequently. That we're going to need to stay with that protocol for the foreseeable future, especially here through the holidays and through January. We're going to need to really keep our defenses up and keep practicing these protocols because it is working. If you did spend time with anyone outside your immediate household over the Christmas holiday, or you intend to this week, please stay close to your home. Monitor yourself closely for any symptoms at all. Headache, fever, body aches, a runny nose, sore throat, any of those things, monitor them. We're hearing those very frequently with folks who are testing positive. So if you have those symptoms, stay close to home, call the clinic, let's get you tested. So if you feel any symptoms whatsoever, do not hesitate to reach out to either your doctor or our clinic so we can get you evaluated and tested. It's the best way we can keep each other safe. Throughout the holiday season and beyond the holiday season, in-person gatherings need to continue to be discouraged. So we're encouraging you to plan to celebrate New Year's Eve here on campus or virtually with your family via the internet or by phone. But this year is not a year to be out celebrating off campus. And that's true for residents. It's true for us, staff as well. We need to stay with our immediate families in our little bubbles and stay safe because we'll get to the next phase of this, which is vaccination. And that is really the beginning of an end. It's going to be a long process, but we need to stay well and stay healthy through this next phase. This is an important time for us. Westminster Canterbury is very excited to share with you that we are part of the priority group for vaccination. Our community will begin getting the vaccine in its earliest phase. We learned yesterday that we are confirmed to have our first vaccine clinic next Monday on January 4th. This is very exciting news. This is what we've been waiting for, which is some hope that this pandemic can come to an end in 2021. The clinic that will be taking place on Monday, January 4th, will be for our Parsons Health Center residents, the Parsons Health Center staff, and then some staff from the rest of the campus that need to go into Parsons. This is the first of a number of different phases that will all happen here on campus. Vaccination for the whole campus is going to happen in 3 waves. All 3 of these waves are in the first phase, so we're going to get it before everybody else. All the nursing homes in Virginia are in this very first phase, and senior living communities. Within that first phase, they have to break it down into some groups. So there will be a second separate clinic for assisted living residents and staff, and then a third separate clinic for independent living residents and the remainder of our staff. All of this will happen over the next month, 6 weeks. We don't know exactly the time frame, but it's this first phase before the broader community gets it. We don't know the dates of the future vaccination events yet, but we will be working through those details, and we'll continue to update you with each live briefing as we know more. And now that the information is starting to flow, we're starting to get some dates, getting some things confirmed. We expect we'll get a lot more dates confirmed for the future. For this to be effective, for the vaccine to be effective, we will all need to get 2 doses. That's 2 different shots, 3 weeks apart. For those that will be vaccinated on Monday, everybody who lives in Parsons and staff that work in Parsons, they're going to get it Monday, January 4th, and then a second vaccination date approximately January 25th. That date hasn't been confirmed, but that's the date they've told us to hold. Any staff or resident who's not available on Monday because of whatever reason, if they don't get it on the 4th, they'll get their first shot on the 25th. And then there'll be a third clinic for this first group that closes for anybody who misses the first dose. They can get their first dose at the second date, and then there'll be a third date to give them their second shot. Then we'll move to assisted living, do it again, and then we'll do it for independent living. Hopefully that makes sense. We have heard residents express some concern and confusion that assisted living or independent living is coming later. Well, only later in this very first phase. We're all going to get it before everyone else. And so I hopefully that makes sense, and it provides you with some comfort that we are going to all be in this priority group. This week, we are hard at work collecting the necessary consent forms from all the residents or their families, power of attorneys, and staff who need to have their documentation ready for Monday. For any residents for whom a family member or a medical power of attorney must grant permission, Westminster Canterbury will need these responsible parties to quickly return those consent forms. This is a process that CVS, our partner, is managing, so we're going to need to get those forms back quickly. We can take verbal consent and email consent. So someone from Parsons Health Center will be working with all those family members and power of attorneys to make sure we get those consent forms back. Many of you, residents and staff, are asking about how we or how CVS will take care of anyone who might have an adverse reaction to the vaccine. What we know is that there have been a very small number of reactions to the vaccine as they've taken place throughout the testing. I heard this morning that of the 21,000 people that were in the second cohort of testing, 2 people had what was considered an adverse reaction. It's a pretty good rate. I don't know scientifically, I don't know what that means, but we should feel good about that. We want to assure you that both the CVS team that will be here, pharmacists and support staff that will be here on the vaccination dates, and our Westminster Canterbury nursing team will all be available to monitor residents and staff for reactions and provide any care that's necessary. Every person that gets the vaccination will be monitored directly for 15 to 30 minutes after the vaccine's administered, and that depends on your medical history. And our nursing team will continue to monitor throughout that period to make sure everybody stays well. Tomorrow, we will be sharing another memo and an update and an updated vaccine frequently asked questions document with you. So hopefully that will help answer any more questions you might have. I really am hoping, and we are striving to get 100% vaccination of our residents and employees. And we know 100% is probably not achievable, but that's what we want. We would feel the most safe if everyone got the vaccine. Hopefully, we'll get close to that. Now, I'd like to step away, and before I do, I want to introduce to you our medical director, Dr. Danny Felty, to give you his perspective on the vaccine. Dr. Felty is the medical director in our Parsons Health Center. Dr. Felty is also the chief medical officer for Legacy Care Group, which is the group of Dr. Reed, Dr. Cook, nurse practitioner Kathy Pack, and then Danny's our medical director. They service long-term care facilities all throughout Central Virginia and further. Danny's also the president of the Virginia chapter of the American Medical Directors Association, and Danny was also a member of the Governor's Task Force for Long-Term Care. So let me introduce you to Danny. He's going to share with you his perspective on the vaccine and anything else he wants to talk about.
Thank you, John. Good afternoon. I'm Dr. Danny Felty, and it's my pleasure to be able to spend a few minutes with you today discussing the vaccine. And first and foremost, I'd like to express my gratitude and sincere appreciation for the staff and the leadership team here at Westminster Canterbury for an outstanding job through this entire pandemic, and specifically, kudos to you, the residents, and your loved ones. There have been significant challenges through this year, and I think there are much better days ahead. So with perseverance and patience, we'll continue to have success. It's okay to acknowledge that the challenges of this pandemic are real and that the struggle to maintain optimal health, whether it be physically, mentally, or spiritually, are a daily endeavor. And we feel like a lot of folks have a feeling of isolation, and we know that's okay to feel isolated. Most of America feels isolated and hasn't felt normal, especially during this holiday season. But we want you to know that if you need anyone to talk to, Dr. Heck, who is a clinical psychologist, is in the clinic. He's available to talk with you. And if that's what you'd like to explore, the option may be to make an appointment, and you can call the clinic extension there at 6231. And as usual, the pastoral care staff is available per their usual times and guidelines. Regarding specifically the vaccine, I know there's a lot of questions and a lot of information out there. I'd like to take the next couple minutes just to address several of those. And I think as John just mentioned, there'll be some information with frequently asked questions and more guidelines coming out. But you may wonder how a vaccine like this one is developed and how it's tested. Approval of a vaccine for use in people involves multiple phases with different goals for assessing effectiveness and safety in different populations. There are a total of 4 phases, and the vaccine must meet very intense safety criteria before completing each phase. Once a vaccine is approved for use after phase 3, it has been tested typically in tens of thousands of people. So I know there's been some sentiment that people didn't want to go first, but there's literally been tens of thousands of people tested in these phase 3 and phase 4 clinical tests. And throughout each phase, there's constant monitoring and gathering of safety data. And this type of clinical trial has been used for decades to approve medications and vaccines. And specifically during this pandemic and the release of this vaccine, there'll be 2 other independent agencies, one of which is the ACIP, that will be monitoring in real time for further data collection, information, and safety precaution maintenance. The Food and Drug Administration requires 50% efficacy of the COVID-19 vaccine. And the COVID-19 vaccines from Pfizer and Moderna are showing at least a 94 to 95% efficacy rate during the trial phase. Our understanding is that Westminster Canterbury will be receiving the Pfizer vaccine. FDA requires 8 weeks of safety data on this vaccine and will have further reports pending as well. The vaccine safety has been assessed during these trials. Most adverse side effects occur within 6 weeks of the vaccine's administration, and the FDA has required 8 weeks of safety monitoring so it can track any side effects. FDA advises a minimum of 3,000 participants to assess safety. The current phase 3 trials have 30,000 to 50,000 participants recorded. This really demonstrates how safety is a top priority for the FDA and the medical community. None of the proposed vaccines for COVID-19 contain live or killed viral particles, even though some vaccines historically have contained these types of processes. This particular vaccine are based around messenger RNA. Messenger RNA vaccines contain material from the virus that causes COVID-19. This material gives our cells instructions for how to make a harmless protein that is unique to the virus. Some people may call this the spike protein or the M protein. This protein cannot build a virus or cause infection by itself. After our cells make copies of the protein, they destroy the genetic material from the vaccine. Our bodies then recognize that protein and realize that it should not be there, and we build antibodies that will remember how to fight the virus and that causes COVID-19 if we were to become infected in the future. While this technology is new in vaccine development, the technology is being successfully used in cancer treatments for a number of years. You may be anxious about the Emergency Use Authorization, also known as the EUA, and the speed at which the vaccine has been approved. While the EUA is a shorter process, no steps have been skipped and the safety evaluation process is fully intact. We don't know yet how long the vaccine will protect us. Even when people receive the vaccine, they will not immediately be protected and will need to continue wearing masks, social distancing, and practicing frequent hand hygiene. The Pfizer vaccine will require 2 shots with a few weeks between each shot, and protection usually begins 2 weeks after the second shot. While no vaccine is 100% effective, some of the vaccines proposed are anticipated to be greater than 90% effective. This will greatly reduce your chance of getting sick with COVID-19 and spreading the COVID-19 to your loved ones. The vaccines currently being tested in clinical trials can cause some short-term discomfort, such as headache, muscle pains, fatigue, chills, fever, and pain at the injection site. And this happens in a percentage of people who receive these and other type vaccines. This is the effect of your body developing immunity. Clinical trial participants reported that the discomfort went away after about a day, sometimes sooner. When you receive the second dose of the vaccine, the discomfort can sometimes be more pronounced. This is a normal reaction, so be prepared. If you experience discomfort after the first dose of the vaccine, it is very important that you still receive the second dose a few weeks later for the vaccine to be effective. This does not mean the vaccine has given you the COVID-19. Rather, this means the vaccine is causing your body's immune system to react and create antibodies to fight off the virus. In other words, if you feel some discomfort, the vaccine is doing its job. We are very excited to begin the vaccination process here at Westminster Canterbury Richmond next week, and we encourage everyone to take advantage of it. This is the best next step forward in our community, staying healthy and getting one step closer to being able to have more programs, services, and visitation available. Thank you for your time today, and up next is Debra Jacobsen.
Good afternoon. I have several updates from the Resident Services Division. First of all, from the Wellness Department, we hope you enjoyed the December Wellness Bingo and want to remind you to let us know if you completed the challenge. You can give us a call or you can leave your bingo card at the front desk addressed to the Wellness Department. We want to reward you for your hard work. But we're not going to let you rest for long, because stay tuned for the information about the January Wellness Challenge. Most importantly today, I'm excited to announce that the Fitness Center and the Aquatic Center will reopen by appointment only on Monday, January the 11th. All appointments will be for 30 minutes, and residents will be allowed 3 appointments per week. Appointments are available Monday through Friday, 8 a.m. to 3 p.m. Please note, we will not start taking these appointments until Monday, January the 4th. On Monday, you may call extension 6669 to schedule an appointment for the Fitness Center and extension 6539 for an appointment with the Aquatic Center. Please leave a message if no one answers, indicating your preferred day and time for the wellness staff, and they'll give you a call back to confirm. We will continue to offer the Zoom exercise classes for our independent living residents. If you're interested in participating, please call Julie at extension 6264. We hope to have small group exercises back open in a few weeks, so stay tuned for more information. Transportation. We're happy to announce beginning Monday, January 4th, transportation will begin again scheduling for non-essential transportation appointments. These are for those things such as bank appointments, business appointments, and those who work outside of the community. To schedule a ride, you can fill out a transportation request slip at the tower or the center desk, or leave a message for Ethan at 6263. Salon Services is also excited to announce that they will reopen on Monday, January the 4th. We will be working in the Main Street Salon only and servicing those independent living residents at this time. Some of you have already received a call from your stylist and have appointments set up. Those appointments were made based on the clients who were scheduled on the day that we had to close. We will be operating with the same protocols as we did prior to our last closure. All appointments are scheduled by calling 6281. You must wear a mask during your entire service, no exceptions. Due to social distancing, there is no waiting area in the salon, so we cannot accept walk-ins or early arrivals. We must adhere to the social distancing, so please no visiting with other residents in the salon or in the hallways outside of the salon. The salon's team continues to adhere to the highest standard of sanitation and sterilization in the salons for your safety and others. This requires time to execute properly and limits our ability to service the same amount of clients per day as we did prior to COVID. This means we cannot guarantee weekly standing appointments. We are asked that you limit your requests for those services to every other week and to allow staff to service other residents. We are booking our appointments 1 week out at a time in order to remain flexible enough to expand into our other salons in the future. We hope to reopen the assisted living salons in the next few weeks, assuming everything goes well. I know everybody's excited. One final reminder from me. We understand that during the holidays, many of you were trying to share your treats and your goodies in the hallways so your neighbors could enjoy them as well. We ask that you please do not put out those foods to share with your neighbors and to minimize the risk of transmitting any diseases or illnesses among each other. Lastly, for me, we will continue to monitor the services and programs that we mentioned above. These are all services and programs that are manned by staff. We hope that everything is very successful, and in the next couple of weeks, we will be giving you an update on other programs that we will be able to open. So with that, I'd like to say to you, have a happy new year, and I'll turn it over to Gayle Haglund.
Good afternoon. That was a lot of great news from Debra Jacobsen, and I can't wait until I can get my vaccine. So happy New Year, almost. I want to give you a quick update on the Foundation's progress. The annual fellowship fund now stands at just over $1.6 million. Well, $1,602,158.92 to be exact. Our goal is $1.65 million. There are a few days left to send your gift to continue to help our neighbors who need financial assistance. A gift to the Fellowship Fund helps welcome very deserving people to our community who otherwise couldn't afford a healthy retirement. Your gifts are also an investment in our ongoing program, which assures each and every person here that they will never be asked to leave for financial reasons that are no fault of their own. Your gifts are also needed for our area of greatest need, which helps us subsidize any of our campus programs in need of funding. Thank you so very much to those of you who have already been so generous this year. What a joy to serve such a generous and loving community. Next up is Glenn Kemp.
Thank you, Gayle. I'm here to announce that Westminster Canterbury is going to proceed with changing the emergency nurse call devices in the tower, glebe, and garden. You will recall that we initially wanted to start this project in December, but our extra precautions and independent living caused us to push this back. We are still proceeding with an abundance of caution and have developed safety measures in order to move forward, as it is important to ensure the safest and most up-to-date equipment is operating in your homes. Therefore, on January the 5th, 1 week from today, Westminster Canterbury staff and contractors will commence with replacing devices starting in the tower on the 8th floor. While staff and contractors are in your home for about 20 to 30 minutes to install equipment, we ask that you wait in the commons area of your floor. It will be important that you stay close by, since we will have a quick training and documents for you to sign once equipment is installed. We sincerely appreciate your cooperation as we move forward with this effort. If you have questions, feel free to reach out to myself, Rob Robinson, Kwang Lee, and IT, and we will assist you as best we can. Thank you, and up next is David Curtis in Pastoral Care.
Good afternoon, everyone. I'm David Curtis with the Pastoral Care Office, and a few updates from our office. Please join us for evening prayer every day through the week, Monday through Friday at 4:45 p.m. on TV 970. Please note that there will not be an evening prayer service this Friday on January 1st, however. Please also join us for worship on Thursday, December the 31st at 10:30 a.m. on TV 970. I will be preaching, and Reverend Deacon Logan Augustine will preside at the service. A sermon for every Sunday will be shown on this coming Sunday, January the 3rd at 4 p.m. on TV 970, and Father Mike Reniger, pastor at St. Mary's Catholic Church, will preach on Isaiah 60, 1 through 6. We are very grateful that we are able to offer a sermon for every Sunday. If you happen to miss one, or if you would ever like to rewatch a sermon, you can do so online at www.asermonforeverysunday.com. That's www.asermonforeverysunday, all one word, .com, or simply search for Sermon for Every Sunday on a browser. The January prayer booklets will be available on Thursday, December the 31st. If you have received one previously, we will place one in your box again this coming Thursday. If you would like a prayer booklet, these prayer booklets contain a weekly rhythm of prayer along with our Thursday worship bulletins. If you would like to receive one, please call Vanessa Perry at extension 1502 or call me at extension 5179. And lastly, Merry Christmas. We are still in the Christmas season, a season that lasts for 12 days. The season of Christmas officially ends on January the 6th, which is the feast of the Epiphany. That is when we celebrate the arrival of the Magi. And although today is, in fact, the 5th day of Christmas, I will not belt out 5 gold rings to end out my session. And for today's scripture, hear this passage, which is taken from the 3rd chapter of the book of the prophet Malachi. See, I am sending my messenger to prepare the way before me, and the Lord whom you seek will suddenly come to his temple. The messenger of the covenant in whom you delight, indeed, he is coming, says the Lord of hosts. But who can endure the day of his coming, and who can stand when he appears? For he is like a refiner's fire and like fuller's soap. He will sit as a refiner and purifier of silver, and he will purify the descendants of Levi and refine them like gold and silver until they present offerings to the Lord in righteousness. The word of the Lord. Thanks be to God. The section that we just heard from the prophet Malachi contains some of my favorite passages from Handel's Messiah. The blending of voices in that choral piece about the purifying of the sons of Levi is so amazing that it somehow belies the nature of what it means to be refined by God. The process of purification is sometimes hard, and it is rarely without sacrifice. I can't think of a more crucible year for me or for any other people I know than this year. So many of us have been refined, it seems. This year has shown me what is truly important. It has led me to be flexible, to be creative, to be resilient. There have been times when the refiner's fire has seemed too hot and too much, making me wonder if I will be consumed in the fire. But like the descendants of Levi, I think that we too shall be purified. We too shall understand God and God's will for us in this world differently. We will understand God's will for ourselves differently. As we approach the new year, let us claim and proclaim our nature as refined gold and silver, and let us present our offerings of ourselves to God so that we can change this world, not to what it was, but to what it is becoming. Let us pray. Gracious God, you have called us to be your people and your children. Change us with your Spirit so that we may bring about your reign on this island earth. Take away from us those things that do not serve us, and leave us those things that allow us to better serve you and each other. In your holy and refining and transforming name we pray. Amen. And a reminder that there will not be a 3 p.m. update this coming Thursday, December the 31st. Our next update will be on Tuesday, January the 5th at 3 p.m. And please join us then. Merry Christmas and Happy New Year, everyone.